Yeah, totally agree. And, I am a little esoteric in my kind of fibular fixation practice, having turned to intramedullary nailing for fibulas for a while, and a little bit of a sidebar commentary maybe, but just on the around the concept of having to take out hardware. And that's for my practice has been the game changer. Just not doing removal of hardware for fibula fractures near as often as it used to be necessary. So
Yeah.
I think that's a great point, to kind of be thinking about the downstream implications of our fixation choices. A
I think there's definitely. I mean, you bring up a good point there. I was thinking about this earlier today, and I didn't write it down on our shared list. But like the fibular nails, there's now a lot more options. It seems they've. I don't know if I want to use the word exploded, but I
not
can
yet.
not yet. But I can think of. Let's see. We have Arthrex, we have Coventus, we have. I think Vilix has one now. We have the Acumed as the OG.
The OG.
And is there any other ones? Somebody will have to like reach out and slap me, but
Yeah, no, I think that development is right around the corner. I think next year's conference will have a couple more. I'm,
I
I'm
think you're
quite
right.
sure of it. Proponents of that technique and technology would say, and good reason for it, right? I
Mm-hmm.
mean, I think just the fact that there used to be one and now there's four is
Yep.
telling. And I wouldn't call it a groundswell movement yet, but the fact that industry is responding to that need or
Mm-hmm.
maybe to that want, I think is predictive of market share.
Yeah, I think you're right. And I think the one thing I'll say is, I don't know, definitely don't nail every fibula. I know there's been definitely a trend, or probably over the last maybe 6 months, and some of it has been in patients that I'm concerned about wound healing or implant difficulties. I can think of a gal who had a bleeding disorder and had another problem with a wound dehiscence somewhere else, and so I felt like that was a good indication for using something like this. Also, you have to get some experience with them because you don't want to just use them one off on some of these more, I don't say more challenging, because the fracture may not be that challenging, but you don't want to use it one off. You want to make sure you get some reps with it beforehand. So I think getting some of the more straightforward patterns, I think has been actually helpful for me to kind of get some of the nuances down with
Absolutely, yeah.
instrumentation.
If the quote unquote perfect indication is a disaster fracture pattern or soft tissue envelope, it does taint your I guess attitude towards the implant, right? And I think some of the low energy elderly bimal equivalents or bimals are kind of begging for a really simple
Mm-hmm.
reduction and a really low profile
Yep.
biologic friendly approach to fixation.
And you have to maintain length on
Don't get
those.
me on a rant, Nick.
Yeah, I know. Well, I was like, we're gonna go down this, and we're gonna you have to maintain length. I think that's the one thing that is you have to be very cognizant of that. So my residents love it because they don't get to nail fibula anywhere else, and and so then that that obviously sways things a little bit. They're like, can we nail